the PCTU hospital, like the hospital run by PCTU University. We are going to every department in this hospital, which is run by PCTU, the university, Phan Chau Trinh University.
They can join with the examination with ultrasound.
Okay, that's great. So your hands-on training is really good, doctor. No, I have never seen any colleges, even in the other countries, who really give so much of hands-on training. Even in India, the students start going to the hospital only from the second year onwards. So you bring them from day one. That is, that's absolute.
Here is the OBGYN examination room for one patient.
Okay.
I think the privacy for the patient is kept very, very well here.
That's important. That's very important, especially in the OBG department.
Yes. All patient data are kept electronically.
So you have the complete system for the data management. So when a patient walks in, they don't have to again re-enter everything.
Yes,
so when you enter the register number, you get all the data out. That's great. So this is a 4D ultrasound.
Yeah, you know, Asian people, they want to see the real face of the babies.
This is nice.
Yeah, here's a doctor and OBGYN doctor. The patient can see the image.
Okay.
This screen here is endoscopy, very modern.
Yeah. I know.
Okay,
and it's good for all the women to get it checked periodically, at least after 35.
Yes.
In India, the doctors recommend us to take a pap smear test and
every year.
Every year.
That's
mandatory for us. Yeah. That's great, doctor.
Yeah. What about the problems, symptoms?
She has a lower abdominal pain and vaginal leak. My name is Dawn, and I'm
Dr. Dawn.
how we interact and how we learn English medicine in general country hospital.
Yeah, I know. And this is the gynecology department again. OBG. Yeah.
Do you have any vaginal bleeding? Yes? Oh, no, okay. So do you feel good today? Yeah, thank you so much.
Which university you are into?
I study in Phan Chau Trinh University.
Okay.
Yeah,
Okay. This is their own hospital.
Exactly.
Yes.
Maybe 8 general hospitals around the country, around Vietnam.
Oh, that's great. How many patients will be here approximately per day? Not only gynecology department, overall.
I think it's over 150 patients per day. I think it also depends on the day.
The amount of knowledge you have in the department, gynecology, at the 4th year is amazing. I should thank the teacher, the doctor here, who trained you really well. And you know, in India too, like when the students at the 5th year, they start going and seeing the patients. After 4.5 years, they get into the hospital. Now you got that. From day one, you get the exposure.
Yeah, they are so confident.
You know better how to interact with the patient.
Exactly, but we need to thank the patient so much too.
Thank you so much. Get well soon.
Yeah, get well soon. Thank you.
Oh, you are in the surgery department.
The 5th floor.
Oh, okay.
Surgery department. In this department, we perform the orthopedic, normally orthopedic, urology surgery, and thoracic surgery also.
Surgeries. Okay.
Operation theater.
Okay.
So the patient come here for operation, free anesthetic room.
Yeah.
So we'll check the patient.
Yeah.
Overall patient. If the patient have good condition for the operation or not.
Okay.
The patient can come to the operation room here. So,
all right, straight here. Okay.
So for the operation room, if it's an operation.
Okay.
students from the second year or third year,
Okay.
they begin to clinical practice.
So they can see the operation from second year.
So they can learn the procedure.
That's great.
We have 30 beds here in
Oh.
the surgery department.
We have 30 beds in the surgery
Yes,
departments.
Okay, I show you some patients here. Some
Yeah.
operation we perform here.
Yeah. Thank you. Get well soon. They are allowed to assist the doctors in the surgery room. That is a very big thing in the operation theatre.
Okay.
And we have 6th year students also here. So they know, then they can share their knowledge with each other. This is one of the best a
Yes.
student can get in a medical career.
Yes.
So we are still in the surgery department.
Anh cho em ngồi giới thiệu xí hết nhé. Thì cái này we perform the laparoscopic surgery to clean the abdomen and also to close the stomach.
He looks good.
He look good.
Examination with the patient directly. So they have second year students and 6th year students together. They are going to examine the patient.
Preparative appendicitis we perform laparoscopy.
Okay.
Yeah, it's really rare that we perform
That's
the
really
open.
good. That's good.
Okay.
Because there's no cut surgery. Get well soon.
Thank you.
We are going to the internal department.
Yeah.
They are the students who are actually having their hands-on training in the internal department from PCTU. Yes, doctor. Hi, Deepa. You are students?
Yes.
Okay.
50 or 60 inpatient.
Okay.
Yeah, in
There are
department.
50 to 60 inpatients in the internal medicine department.
Yeah.
Fine. That's a very good number. Okay. I heard this is one of the best hospitals in the city.
Thank you. I appreciate that.
Which year you are in?
I'm a fifth year.
Fifth year. Oh.
So we can start, doctor.
Patient have a dengue fever.
In India also we have dengue fever, but when we go to an European country, they don't know what is dengue fever. So when our students get trained in this hospital with all the diseases, what the people face here, it will be easy for our students to come back to India and experience as a doctor.
Yeah.
Yes, doctor. It was really good meeting all of you. So how is your experience in this hospital as a student?
Oh, it's really good. I'm studying for Indian medical student.
Mm-hmm.
Yeah.
So this is the internal medicine department, which we had a very good experience by meeting a patient with dengue fever, and we had an interaction with the students as well, and we experienced how the students are updated with the reports and the case study of a patient. So let's go to the other department. In the pediatric departments of PCTU University, where the students are going to get their hands-on training from the first year onwards. So this department looks so nice. They are nursing students of PCTU University.
Yeah.
So they study nursing in the university and they have the training classes in the hospital. It's 90 to 100 inpatient and outpatient together per day. So that's a very good number in pediatric department. So we see this is one of the best hospitals in the pediatric department.
We'll do some clinical checkup for you for today.
Now we had a complete examination of dengue fever and they are completely monitoring the patients every day. The students are involved in the complete the examination, the monitoring, and also they have been taught every day, whenever they meet a patient, when they see a patient, they have been taught. The most important part is the hospital is very clean and tidy, and students are here from morning 7 a.m. till evening 4 p.m. every day. Nice meeting all of you, and we hope you become the best doctors in the country.
Yeah, thank you.
And welcome to India. Thank you.